Isn't it, right? It's a big dream. Has anyone lost anybody to an overdose or known a person that's died from an overdose? So we can all feel that pain, right? And we can share that together. So let's not have those lives lost in vain. I think it's very important that we come together here. There's so many stakeholders in this room. And honestly, there should be 10,000 people in this room, but there's not right now. And part of the reason is lack of courage. People don't want to face this issue. It's scary, it's frightening. The answers aren't simple. So I want to thank again Francine for all she's done. And I'm kind of joking around, but seriously, she was in this and back in the day before people really getting the whole idea behind how serious this was. She saw the trend and she was basically able to forecast where we're at today. And so my name is Raj Mehta. I'm a therapist at Serenity Therapy Center. I work as a clinician. I do interventions. I'm also a recovering person. On May 15th of this year, I achieved 10 years of sobriety from drugs and alcohol. And my success is your success. And so I talk about that. It's real sobriety, okay? Not the bullshit kind where I hit off a joint or some Suboxone or some methadone. I don't say this to be mean. I say it's because I've been on both sides of that fence. I've been, have used Suboxone, I have used methadone. And the last time I was in Brighton Hospital, my insurance company only paid for 7 days of rehab, basically detox. And so I was detoxing from heroin, Oxycontin, methadone, cocaine, soma, alcohol, and I think I'm missing one. Oh, Xanax. So I'm coming off of 7 different drugs, okay? And I'm in Brighton Hospital, and my vomiting is so bad that they are worried about me tearing my stomach lining apart, and they're giving me injections to stop the vomiting. And Dr. Mark came in and goes, Raj, we're going to give you Suboxone. And I said, no, I'm not taking it. He goes, Raj, you got to take the Suboxone. It's very important because, we got to detox you here properly. And I go, I'm not taking it because all it's going to do is prolong the rest of this. He goes, well, you have to have it. I'm asking you, administratively, you have to have it. And I smile and go, Dr. Mark, I have a Suboxone allergy. He looks at me and goes, really, Raj? And I go, yeah, so therefore, I can't take it. He goes, you want to do this the hard way, yeah? And I said, the hard way. That's how we did it, with a drug called Catapress. Who knows what Catapress is? Just a heart medication, right? That's old school. Catapress, and something for my tummy and some injections to stop vomiting. And that's what kind of, brought me into where I'm at today. So I'm not talking disparagingly about anyone that's on medication-assisted treatment, okay? Suboxone and methadone is, for some people, in a pinch, but it's not the gold standard. Okay, let's be honest about this. If you love somebody, right? If you really love somebody, would you want them to have a normal brain scan? Would you want them to pass a drug test? Okay. Well, when you're taking Suboxone and methadone, you don't have a normal brain scan because, see, your brain doesn't know the difference between a Schedule 2 and Schedule 3 narcotic coming from a doctor versus coming from a dealer. And you can't pass a drug test. So I don't want to be seen as how did I become the bad guy for promoting drug-free? Think about that. How did I become the bad guy standard? So talking about that, it's an honor to be here in this room. And many of us have lost someone to an overdose, and that's really tragic and horrific. And my thought process on that is how do we make the universe come back into balance? And one way to do that is by trying to get 10 people sober for every person that's died. Play an active role in helping someone get sober, to make up for that ratio. A 1-to-1 kill ratio won't win a war. We can agree on that, right? So when we lose somebody to addiction, when we see that posted on social media, we should say to ourselves, okay, what am I going to do to influence and get 10 people into the right direction? And that's powerful, right? That's very important. And so those losses cannot be in vain. One of my close friends, Jerry, him and his wife Kimmy were hanging out together, and we all were kind of friends for a while and went to high school together, and we kind of went apart when I got sober. And so Kimmy called me on the phone one day and said, Jerry died of a drug overdose. And so he died in the stamping plant at Chrysler over there in Sterling Heights. And so a lot of shame because his dad was a big executive at Chrysler. I'm really embarrassed about that. And so, Kimmy, I'm so sorry to hear that. She goes, Raj, the story gets worse. I go, how can this get any worse? And she goes, I'm doing heroin and I'm pregnant. And I'm like, oh my God. Because see, Jerry lied to me. He didn't tell me him and his wife were using together, right? And so I said, I'll be there in 20 minutes. I took her to her first NA meeting, and she hasn't used since then, okay? But we had a lot of tears behind the scene to make that happen. And so fast forward, about a year later, I'm at St. Anastasia's Church in Troy, okay? I'm there for the Godfather ceremony. And so Kimmy's holding the baby. She still has her wedding ring on. And so the priest looks at me. It's 9 o'clock in the morning on a Saturday. He goes, "Who are you?" And I go, "I'm the Godfather." Sees the wedding ring on Kimmy's finger and goes, "Where's the father at?" And Kimmy kind of looks down and goes, "He can't be here today." So the priest takes the baby out of her arms, walks towards the front. He goes, "I can't understand why the father of this Christian child isn't here on the most important day of this Christian child's life." And Kimmy breaks down sobbing uncontrollably, holding my arm right here, soaking wet with tears, saying, "He died of a heroin overdose." And that's when it became very personal to me. So what does that mean? I had an epiphany in that moment. In that moment, I realized addiction killed my friend. Now, what are you going to do about it? Because I was already sober then. That was nice. I mean, it sure made addiction a little bit upset about me not using drugs and alcohol. But I want to bring it to the next level. So I said, I'm going to go to graduate school and become a therapist, an interventionist, and really piss off addiction. Right? And that was the plan. And I graduated from U of M with a master's degree. I'm a licensed master's level therapist, and that's what I do. And so trying to make lemons into lemonade.